Heart disease is the leading cause of death in the United States. A total of over 597,000 deaths in 2010 were reported according to the CDC, even beating out cancer. Heart disease is often called the silent killer, mostly because the symptoms are completely undetectable and you could have a massive heart attack and unfortunately not make it. I currently work as a registered nurse in the hospital. I frequently work with patients with heart disease and often patients that have just had a heart attack and are recovering. This is important because I really want to help make the public more aware of how to prevent heart disease. And this also has a very personal connection to me because my dad has multiple risk factors and I would really like for him to modify his lifestyle. He's currently obese, he's more than 300 pounds. He smokes 2 packs a day. He's on medication for high cholesterol and he's on medication for high blood pressure. So today I really want to help potentially convince him in order to modify his lifestyle, and also I would like to share the knowledge that I do have. So today I'm going to be talking to you about the basic anatomy of the heart as well as the basic function of it, as well as what a heart attack really is and what some causes of a heart attack are. I'd like to talk to you about the signs and symptoms of a heart attack, what you could expect to experience if you do have one, as well as preventative ways to reduce your risk factors. So to begin, the basic anatomy of the heart, it's the size of your fist and it's in the chest cavity. It's located to the left side, and the heart is actually a muscle. So just like if you hurt your ankle, or if you hurt your leg muscle, that side's always going to be a little bit weaker and it's not going to be tip-top shape where it should be. And same goes for the heart because it is a muscle as well. The more you damage it, the weaker it gets. I do have a visual aid. It's from the National Institute of Health, which is a resource for the U.S. Department of Health and Human Services. This is right off the website. This is a diagram of the heart. I wanted to talk to you a little bit about how the heart is made up of 4 chambers. It's the 2 atrium on top and the 2 ventricles on the bottom. The basic blood flow of the heart. So the heart comes through the right ventricle, and this is deoxygenated blood. So this is blood that the oxygen has been used up by the body and it's returning the heart to get reoxygenated. So it goes from the right atrium down into the right ventricle, and then it goes out into the lungs, and then the lungs oxygenate this blood, and it comes right back through the left atrium, goes through the left ventricle, and then it goes through the aortic valve and gets pumped throughout the body so it can perfuse the body with oxygenated blood. This diagram also has pictures of the coronary arteries that are surrounding the heart. These are the squiggly red lines that kind of look like veins, but the purpose of the heart is to perfuse the entire body with blood. The coronary arteries' job is to just perfuse the heart with blood. So they just work for the heart, nothing else. So the basic functions of the heart we kind of already discussed, but just to recap, the purpose of the heart, oxygenate the blood and push throughout the body, and the coronary arteries perfuse the heart muscle and keep it pumping. Next, what is a heart attack? What exactly is it? The proper name for it is called a myocardial infarction. And if you break apart the word, infarction means a blockage or an inability to pass through something, and myocardial is heart muscle. So if there's any type of blockage in this heart muscle, it is essentially going to be a lack of oxygen to this heart muscle because it's not being perfused adequately. The most common cause for a heart attack would be coronary artery disease. According to the CDC, the Center for Disease Control, it's a buildup of plaque in the arteries. So I'm going to bring back the visual aid. On this side of the diagram, this is one of the large coronary artery vessels, and this yellow part is actually a buildup of plaque. Plaque is often in cholesterol deposits, so if you have high cholesterol, you have a higher risk of developing coronary artery disease. And eventually what's going to happen is the buildup of the plaque is going to completely occlude the vessel at one point, or part of the plaque is actually going to break off and become dislodged and continue throughout the blood vessels until it gets to a crook in the road or a smaller area where it's unable to continue to move through and blocks the blood flow and essentially causing a heart attack that way. So these are all important things to know, because if you do have a heart attack, it's not just that one time you have a heart attack and if you survive, that's great, it's all over with. Once that part of the heart muscle dies, that you can never recover that muscle again. Each heart attack you have continuously makes the heart muscle weaker, and it's not going to pump effectively enough, and not enough blood supply is going to reach the rest of the body. So it's very important to prevent the heart attack completely in the first place, because you don't want your heart muscle to be weakened or damaged at all. So now that we know a little bit about the anatomy, what causes a heart attack, what actually do you feel when you have a heart attack, or what would be some signs and symptoms that you would witness from somebody else? So I have another visual aid. This is from the National Institute of Health as well. And I just want to let you guys know that all of these resources that I do have and I'm getting this information from, they're very easy to find. CDC.gov or NIH.gov are really great websites to check out in case you want to use this information to help tell one of your family members or try to explain to somebody else the importance of knowing the signs and symptoms of a heart attack so you can act fast and help prevent any further damage. So this just has the 6 most common signs and symptoms of a heart attack. So I'm going to go through them. First, we know that chest pain is very indicative of a heart attack, but it's not just chest pain. It could be chest discomfort, it could be chest pressure, anything that's very uncomfortable or it hurts when you breathe, that is a symptom. Also, pain that radiates down the arm or the jaw or the neck or back pain or shoulders, anything that's connected up there, that is also indicative of a heart attack. Shortness of breath, that is a huge indicator of a heart attack. Just think about what we just talked about. What is a heart attack? Not enough oxygen that gets to the heart. If not enough oxygen is getting to the heart, then eventually you are going to start feeling that shortness of breath because not enough oxygen is going to get to the lungs as well. You could also feel lightheaded, which is not enough oxygen to the brain, or start sweating profusely, which is also a neurological symptom. You could feel some feelings of indigestion or nausea and vomiting. That's a symptom that not many people know about. That would be a sign of a heart attack. The stomach is located right underneath that heart, so if you're having those pressure on your stomach or indigestion that could cause nausea and vomiting, that's really caused by the heart. Another generalized symptom would be any type of fatigue or weakness. If you just feel run down or just tired and you can't get up, that could be very indicative of a heart attack. Women don't normally show the typical chest pain, the movie style where a man grabs his heart, falls to the ground, and everyone knows he's having a heart attack. A woman, on the other hand, could just feel very tired for a couple days, nausea, vomiting, something like that, and they could actually be having a heart attack. So it's really important to know your risk factors as well, so that you can try to prevent your chances of this happening. So now that we know about signs and symptoms of a heart attack, how do we prevent it? So a lot of this information is going to be coming to you from the American Heart Association, and unfortunately there are risk factors that we cannot change at all. These factors would be age. The older you get, the higher the risk of a heart attack. Genetics and family history are, unfortunately, you can't change your past. So if your parents have high cholesterol or high blood pressure and your grandparents died from heart disease, you are at an extremely high risk for developing heart disease yourself. Also, males unfortunately have a higher risk of developing a heart attack as well. But on the good side, there are a lot of risk factors that you can modify and you can change and make yourself healthier. So these would be obesity, if you're a smoker, physical inactivity, high blood pressure, high cholesterol, and then also some lower ones that can be grouped together. There are stress, alcohol use, and diet. Each of these factors, they contribute to what causes high blood pressure. So if you think about it, if you're obese or if you have a poor diet and you're not really exercising regularly, the likelihood of you having high blood pressure and high cholesterol is extremely high. So all of these factors are interrelated and completely connected. So if you start changing one part of your aspect of your life, it's very easy to start changing the rest of it. If you quit smoking, change your diet, start going to the gym, you just knocked off all those risk factors and you're one step closer to being healthier. The American Heart Association is promoting heart attack prevention because it's as easy as ABC. This acronym stands for avoid tobacco, B, become more active, and C, choose good nutrition. So avoid tobacco, become more active, choose good nutrition, ABC. So this is very important because you do not want the long-term damage if you do have a heart attack. If you do have a heart attack, you can wind up with heart failure, which is the muscle's not strong enough to pump that blood, and the blood ends up backing up into the lungs and causing a lot of shortness of breath. You could have additional heart attacks, and you can also have a much higher risk of strokes after your first heart attack. So to review, basic anatomy and physiology, we know what the heart does. It oxygenates the rest of the body with blood and oxygen. What exactly is a heart attack? We know that it's when you have coronary artery disease, which is the number one cause of the heart attack, and you have a block of one of those arteries, which prevents the blood from continuing to perfuse the heart. We know about the signs and symptoms, more than just chest pain that everyone usually knows about, and we also know how to prevent and change some of those risk factors. If anybody remembers anything from today, please, if you see anybody having these signs and symptoms, or if a family member comes and talks to you about anything, please call 911. Please start the response time, because the shorter the response time, the less the damage that the heart actually experiences. So we definitely want act fast and know the signs and symptoms. So I just want to recap and say that every year, over 935,000 Americans have a heart attack. Could you be one of them? And with this information, you could really change your future or save somebody's life. Thank you.